Hello everyone, my name is Dr. Sangam Singh and I am a neurologist at Dr. Ram Manohar Lohia Institute of Medical Science. Today I am going to tell you the difference between seizure and epilepsy and how will you know if you are suffering from an epilepsy or you are just having a single episode of seizure. So what is the difference? What is seizure? The seizure is like there are billions of neurons in our brain, and when some of these neurons fire at excessively higher rates, this excessive firing may sometimes produce episodes of seizure, and these seizure can be in the form of motor symptoms or sometimes sensory symptoms. So sometimes when these symptoms are in the form of motor, we usually came to know that we are having an episode of seizure, and sometimes these episodes can be in the form of sensory symptoms. At that time it is very complicated and very complex even for us to diagnose it as a seizure. For that we use help of imaging like CT scan and MRI, and we also use help of EEG, that is electroencephalogram. So if a person having single episode of seizure, and that is because of either head injury or some electrolyte abnormality, or sometimes because of low blood sugar or high blood sugar. In this condition, if we correct these metabolic conditions, the seizure are more likely to be not occur after that episode. So other than head injury, in case of head injury, the chances of recurrence of these seizure episodes, or we can say that the chances of multiple episodes of seizure in future are very high. So in that case, this patient with who are having seizure because of head injury, in that case this patient can have or may develop epilepsy in coming future if they have recurrent episode of seizure. So the difference between seizure and epilepsy is the recurrent episode of seizure. If someone having single episode of seizure, they are not epilepsy. In that case, we need a neurologist. You have to consult a neurologist to tell or differentiate whether this single episode of seizure have any chances of recurrence. Such that if this seizure episode, is there any chance that this type of symptoms can happen in future? If there are chances that even after a single episode of seizure, you are having risk of developing this seizure again and again in future, you can be classified as epilepsy. So epilepsy is a condition when you are having higher risk of chances of seizure, and either you are having multiple episodes of seizure because of any reason. So how we treat these conditions? For the seizure, we treat for single episode of seizure. Sometimes we don't give anti-epileptic. We treat acute conditions like seizure episode with multiple drugs, or even sometimes single drugs. If the seizure are controlled, we sometimes give the anti-epileptic drugs. These are the medication that control seizure for short duration of time, that is 3 to 6 months. But in case of epilepsy, it is very important to identify what kind of epilepsy is that and what causing this epilepsy syndrome. That in that case, in that condition, the role of neurologist become very important. So how will you know that you are suffering from seizure or you are suffering from epilepsy? So if you had or you are having an episode of seizure, in that case, first the question whether it is a single episode or you are having multiple episodes. If you are having multiple episodes of seizure, then there are chances that you may be suffering from an epilepsy. The cause may vary according to age. In different age group, etiology and its causes are different. But if you are having if you had an episode of seizure, single episode of seizure, and you did not had any another episode of seizure, there are chances that you are not suffering from an epilepsy. But for this to be sure, you must have to consult a neurologist. You have to go underwent multiple investigation, EEG and MRI, to confirm that this seizure episode is an isolated episode and you are not suffering from an epilepsy. So for this, I will say that if you are having multiple episodes of seizure, you may be suffering from an epilepsy. If you had single episode of seizure, you have to go for multiple investigation, CT scan, MRI and EEG to confirm this is an isolated event, and the chances of having recurrent episode like this in future are very less. So this is the difference between seizure and epilepsy. Thank you.